Thanks a lot. Dr. Mohammed, so where is the issue? I mean, everything that we are hearing about AI sounds great. Everything that Dr. Bakr also told us sounds great. I mean, everything is cool. So, what are the barriers? Where are the issues, and what are the barriers in the AI adoption across healthcare organization? What would you think about that?
Well, it's a good question, and it's a bit of a tough question to answer. But I think in my experience, when a lot of people, they ask why hasn't AI transformed healthcare as quickly or rapidly as it has with other industries yet? And most of the time, they assume that the problem is the technology itself. But in my experience, most times it's not about the technology. That's not really where the barriers lie. But I think the first thing would be the data itself. So with AI, I think we've covered this, but I'll reiterate it because I think it's very important. In AI, data is everything. And I don't mean just any data. It has to be clean, structured, and clinically meaningful data. Most organizations you look at, and they'll tell you, yes, we have plenty of data. The data is right there. But then you look a little bit more closely, and the data is scattered across multiple systems. It's buried deep in free text, in PDFs, and it's not the right way to approach the AIs. Any AI will only be good as the data that you give it, regardless of what model or language or algorithm that you're using. Think of it like cooking. Even a world-class chef wouldn't be able to make you a great meal if you don't provide him the right ingredients to work with, right? So you need to start with the data. Anytime that you are thinking about implementing an AI tool, the first thing you need to think about is our data ready? Is it there, and is it available in the right way? The second thing I would say is trust. And this doesn't just apply to AI, it applies to any new technology. There's always a little bit of lack of trust when it comes to trying to implement something new. And physicians, in general, I'd say we are generally cautious people. We're trained to be cautious as part of our medical training. So you tend to ask questions, right? Okay, this AI gave me an answer. What is it based on? On what data did it give me this answer? So there are questions about, should I trust this new tool to help me treat patients? The way I think about it is this, though. With AI, it's sort of like having a new intern in the hospital. When you have a newly graduated doctor and you bring them in, you don't, yes, they're doctors, but you don't just give them full independence and let them do whatever they want and make any decisions you want. You start giving them small tasks under your supervision. You see how they're doing, and as they improve, you start giving them bigger tasks, and then you see how they're learning. And that's, I think the same applies with AI tools. Start small, you start with the right tool, you observe, you supervise with human guardrails around it. And then as you see it improving and as you see the outcomes getting better, then you can start expanding. So I think with terms of trust, there needs to be a little bit more trust with the technology, with the right guardrails around them. Thirdly, I'd say, and in my opinion, I think this is a big one, the workflows. I think sometimes we are so entrenched with the technology and the AI and the tool, but we fail to integrate it within the right workflow. Any AI tool that we bring in, regardless of how good it is, it needs to fit into the clinician's workflow, right? If it's just another additional screen and an additional login somewhere else that they need to do, then it becomes harder to adopt and harder to work with. So it needs to sort of be it needs to show up in the right place at the right time for the right person and give them the right information that they need to take the right actions for their patients. It's like a sepsis model that predicts my patient will deteriorate. But if it predicts that after my patient is already in an ICU, then that's sort of like me being in a car and having a GPS telling me to turn left after I've already missed the turn. Technically it's correct, but it's a little too late. So it needs to fit the workflows in the right way. Lastly, I'd say the people themselves, and I think that's an underestimated one. We tend to think of AI as a technology, but we need to start thinking about it as a clinical tool. And so you need to start involving, when you want to implement a new AI tool, you need to involve clinicians early on, because they understand the workflow, they understand the pain points, they understand what they need in order to get the right things done for their patients. a lot of times what I see happening is they build these beautiful complex AI tools, but what happens is the clinicians weren't involved from the beginning, and you end up beautifully solving the wrong problem that wasn't needed to be solved to begin with, when it could have been addressed earlier on. And it also helps with trust. When you involve the clinicians early on, they understand how these tools work. So they understand what data they're using to give you the outcome that they're giving, how is it working, and so the trust and adoption increases with them. But it becomes very hard to do that if they don't understand how this tool is working, or what its limits can do, what it can do and what it cannot do. And I think lastly, I would say governance. And I think governance within AI is still rapidly developing, but it needs to be there. And I think the UAE and Abu Dhabi specifically are already ahead of most of the world when it comes to this. But you need the right guardrails to make sure that what you are doing is done in a safe way. You need to know, where is this data that you have is living, where is it going, where is it sitting? Does your vendor have access to this data? Who is being able to access this data to train models on? All of these guardrails around governance need to be put in place so that when you implement the AI tool and it's being used on patients, real patients, it's falling in line with the right regulations and the right safety parameters that need to be in place for patients.
That's
Sorry,
great, Dr. Mohammed.
I was for a little too long there. Sorry.
No, 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 not at all, not at all. Would love to hear from you. Always great insights. Uh, to be